Now we're going to hear from some payers in terms of what they're doing to advance measurement-based care, starting with Oleg Tarkovsky, Director of Behavioral Health for CareFirst, then move into Martin Rosenzweig from Optum, and that will be followed by Amy Perlman from Beacon. So if you will, Oleg, you're up.
Thank you, Michael, and thank you, MidAtlantic Path Forward, for the honor of being here today. I would like to start with an aspirational idea. I know many years ago when I first became a psychotherapist, I thought to myself, well, every one of us, most of us, go see a dentist at least twice a year to get our teeth checked. How come we don't do that for our heads and our brains? And so that idea stuck with me ever since. So everything I'll be talking about here today will have some context relevant to that idea. Even though I represent CareFirst today, most of the comments and opinions I make here today are those of my own. Could we go to the next slide, please? So earlier on, Howard stole my thunder here. Some of you may know Peter Drucker as the grandfather of modern business management. Excuse me. Unfortunately, often Peter has been misquoted, but we'll come back to this quote later on. Next slide, please. I wanted to start off with a cautionary tale first, and then get to the measurement-based care. Most of you are probably familiar with each one of these companies. Novartis is the Swiss company responsible for making Ritalin and bringing it to market at this point almost 30 years ago. When Ritalin first became available, the easiest way for the pediatricians to prescribe the drug was to make sure that they got enough data, both from the patient, the parents of the patient, sometimes school teachers, and that's where the famous Conners rating scales were introduced. Even though the Conners rating scales do not belong to Novartis, Novartis quickly adapted those scales and made sure that every pediatrician's office had it at their disposal. And very quickly, the prescription of Ritalin became widely available across the United States. And if we fast forward almost 30 years later, we're by far the most country that prescribes stimulants for ADHD diagnoses. Next, we got Purdue on the list. And I'm sort of purposefully going here in reverse order. Most of you probably know this company and the Sackler family that has since been recognized and identified as a disgrace to the medical community. But most importantly, what a lot of people don't know is their involvement in the development of the fifth vital sign, which today mostly known as the pain scale. And similar to Novartis, the pain scale was quickly introduced to the physician's offices, and within a very short period of time, the prescriptions for pain medications, especially opiate pain medications, was very much prevalent across the country. And finally, we get to Pfizer. Pfizer is well known in the psychiatry community for the 3 drugs mostly prescribed for depression and anxiety. Those are Prozac, Zoloft, and Xanax. Again, probably at least 20, 30 years ago, the Prozac nation, as we became known for, has begun. What, again, majority don't know is that the screening tools, PHQ-9, GAD-7, are the copyright for those tools is owned by Pfizer. Next slide, please. So for the good news, at CareFirst and me personally, we believe that great access improves outcomes. And so what we do know is that when people can get help for their behavioral health conditions, those conditions improve, and they improve significantly. And as most of you know, those that treat patients yourselves or work for organizations that do, if patients are compliant with their treatment, the treatment works. Next slide, please. What you're looking at here is a long-term strategy we have taken at CareFirst when it comes to addressing the behavioral health needs of our membership, starting with promotion of mental health, and generally prevention of mental illness. We often don't focus enough on promotion and prevention, and I think using measurement-based care can help us do that in the right way. We also want to reduce the stigma, because stigma is what keeps the patients from addressing care that they need before problems become deep-rooted, acute, and severe. CareFirst has one of the largest PCMH, primary patient-centered medical home programs in this country. And we strongly believe that integrating medical care and behavioral health care is vital in order to improve the lives of the members we serve. And then finally, improving support for special populations like children with autism spectrum disorders or SMI population, as well as some other smaller populations, but with severe illnesses. So how do we do this? Well, we strongly believe that measurement-based care can help our members. We believe it so much that we incentivize our providers in our network to use measurement-based care. We offer training. We partner with our large provider groups to offer this training across our both primary care and specialty practices. So for example, the use of expert. We have recently conducted numerous trainings with our provider groups. And at this point, over 150 physicians' offices have been trained in expert training. We also work with our substance use disorder providers to make sure that they implement measurement-based care in their treatment. And we have scorecards that are associated with those measurement-based care outcomes. If they score high enough on those scorecards, they will be financially incentivized at the end of the year to continue improving. And same goes for PCMH practices. This is the first year where we introduced the depression screening measure into their 10-item PCMH scorecard. Next slide, please. So what do we actually pay for? Pretty much everything. So if a patient ends up in a primary care doctor's office and receives a screening using one of those screeners, commonly used screeners like PHQ-9, GAD-7, they should probably use the 96127 CPT code. And if the screening is done during an annual well visit, the G0444 should be used at that time. Next slide, please. Once a patient is identified to have a diagnosable mental disorder, various ranges of psychological and neurological testing codes are available. And I'm not going to go through one by one, but we pretty much pay for all of the available codes today. Next slide. So this is important, I think. Many people don't see a bigger picture when it comes to what we do every day. And most of you do great work. And as a country, we have continued to invest and spend in behavioral health care over the last 30 years. So much so that dating back to the early 90s and leading up to this year, we're at over $230 billion a year in spending now on behavioral health needs. Unfortunately, when we look at the prevalence rates of common issues like anxiety and depression, they have barely budged in the last 20, 30 years. And so whether measurement-based care is going to help us move the needle forward remains to be seen, but we as a health plan are in full support of using measurement-based care and continue to use measurement-based care in order to support our members. Next slide, please. So finally, if you remember the earlier quote, Peter Drucker actually never said that, but he did say this, and I'll read it out loud because it's one of my favorite quotes in business management. There's nothing so useless as doing efficiently that which should not be done at all. I think when it comes to measurement-based care, as Michael stated, it's not whether we do it or not. It's how we do it, what kind of training we give the folks that do it, and are we measuring the right things? And it's the combination of those three things that will lead us forward when it comes to measurement-based care, and it's used to improve overall behavioral health care for our members, your patients, and the communities at large. Thank you.
Thank you very much, Oleg. Much appreciated.